These are the three shortlisted teams for the Greenwich Directorate. Woolwich District Nursing Team, one of the largest teams in Greenwich District Nursing Service. Greenwich Time to Talk Admin Team, a team within a team, the backbone of Greenwich is increasing access to psychological therapy service. And the Older People's Liaison Team, based at Queen Elizabeth Hospital, Woolwich. This team works with Lewisham and Greenwich NHS Trust colleagues to provide specialist mental health input. Here is John Wallace, Head of Nursing in Greenwich, speaking about the decisions their panel had to make.
The range of teams were nominated by carers, patients and staff. We obviously were really proud of the way all our teams managed through COVID, but the ones that we actually chose in the end really were exceptional. So we're really proud and, it was quite a difficult decision. But in the end, we were all unanimous.
And the winner for our Greenwich Directorate is Woolwich District Nursing Team, which, like I said before, is one of the largest teams in Greenwich Directorate District Nursing Service. The team have been at the front line of this pandemic. They have been dealing with change head-on, going to see patients who have COVID-19 or who have symptoms. All the nursing staff put their concerns behind them and worked their hardest to keep the patients they care for safe and nursed to a high standard. All help to build a positive team spirit. The ethos of this team is led by the award-winning team lead, Melvina, where every team member is made to feel valued and that they matter. A patient said, all your nurses do a great job working within the community. And without nurses like these, life would be very difficult for patients who need nursing care in their homes. These nurses have been excellent in their job and very supportive in providing me with extra dressings every time I needed it. Matthew Trainer visited their base in Plumstead recently under the pretense of doing an Oxford interview and broke the good news to them.
But I'm very glad to be able to come along today because I wanted to say thank you to you and to the district nurses actually for the work you've done during the pandemic. Now this year also, one of the things we've been doing is the Trust Recognition Awards, and your team has been nominated by a number of your peers and by some of your patients as Greenwich Team of the Year. And what I'm delighted to say is not only have you been nominated as Greenwich Team of the Year, but you've won Greenwich Team of the Year. Right. And so, because we're here with Melvina, we thought we'd have a rising star. But there you are. So congratulations, everyone. Well done.
This team has been working their socks off. They've worked really hard. The demands have increased, has never gone down. We would moan if we're tired. We would moan if we don't have lunch.
Yeah.
And then we will sort ourselves out, but we would never moan to see patients.
This is my first year. I came straight into the community. It was a big shock to the system, but it's been challenging, but it's taught me a lot of lessons that I'm grateful for. And yeah, it's been tough, but we've all stuck together well as a team. I think that's why we've pulled through.
It's been a tough year for all of us, as a team, as a nurse, as an individual. But I think the support has helped. Of course, the fact that we all love our jobs, but I think we've been supported very well by management, I could say. And the team members have been just, whatever challenge you throw at them, they just respond to it. They make the work easy for you because, to be candid with you, it's the staff, the people you manage, they're the team.
I just wanted to say to Woolwich team, they've done a fantastic job this last year. They've always been hardworking, but they've done extremely good work, and I'm very proud of them.
Team of the Year was nominated by not only patients but staff and carers, and the panel was struck by the recognition of the very high standard of nursing care provided to those patients and their skills in managing complex problems. Each of their nominations described excellent leadership, which resulted in all the team feeling valued.
Thank you to everyone at the Woolwich District Nursing team for their incredible work. And I'd like to pay recognition to our two highly commended teams as well. The Greenwich Time to Talk admin team, who, as I said, have worked tirelessly to keep the service going, while the therapy and employment services have been operating remotely and online. The administrative team have always been the backbone of Greenwich Time to Talk, but have shown increased strength, resilience, motivation, and dedication in supporting their clinical colleagues, as well as, of course, the clients, carers, and families that we support in Greenwich. Without the admin team coming in every day or setting up office at home, the service would not have been able to operate. And finally, the Older People's Liaison team, another incredible team, working on the front line over the past few months. While other teams have had the option to work from home during the pandemic, this dedicated team have remained by the bedsides of older adults with mental health difficulties at the Queen Elizabeth Hospital. They have continued to carry out assessments and reviews in A&E and on the wards, despite huge anxiety about contracting the virus in the early days of the pandemic. The emotional toll on individuals have been evident, but they have pulled together as a team to support each other through this most challenging of times. Congratulations to you all.